Hello, everyone. My name is Noah Cummings. I'm an MPH student at Liberty University, and today I'll be discussing my practicum project for summer semester 2023. The title is the Vaccine for Children Program Internal Updates. If you want to follow along, the slides are attached in the comment section, and you can pull those up, and I'll be sure to inform you when I move on to the next slide. Next slide. So to introduce this, I just want to give a brief background on what the Vaccine for Children program is. This program was established by the CDC and stands as the cornerstone of public health initiatives aimed at safeguarding the well-being of children across the United States. The Vaccine for Children program addresses disparities in vaccines by providing eligible children with vital immunizations regardless of their socioeconomic status. By ensuring equitable access to vaccines, the program not only protects individual children from preventable diseases, but also contributes to the broader public health goals of reducing morbidity and mortality rates associated with vaccine preventable illnesses. So my first interesting aspect is this is a federally funded program at the CDC, and on paper, we tend to think things are how they are, but being attached to a federal program, there's a lot of bureaucracy that comes with this program. So just to give you an FYI. Next slide. All right, the methods of my program or project was to, effectively help the program internally function a bit better. So the way that we collected data, so to facilitate efficient communication and address concerns about communication speed and accessibility, a shared email box was created exclusively for VFC coordinators. So VFC coordinators are typically people who work for state governments, tribal governments, or local municipalities, and they efficiently run the program for their jurisdiction. The next one is an FAQ repository will serve as a long-term solution to address common concerns while providing accurate, standardized information. The outreach will be created to enhance providers' understanding of program guidelines, address misconceptions, and promote adherence to best practices in vaccine administration and reporting. Next slide. In our data analysis, we would do quantitative analysis will be conducted to measure and evaluate the speed of responses to emails sent to the shared inbox for vaccine funded coordinators. This analysis will provide insights into the efficiency of communication system, allowing us to gauge the response time of VFC coordinators to incoming emails. Utilizing the metric analysis, the goal is to achieve and understand of recurring themes from the data related to the VFC program will be identified. This approach allows for a deeper understanding of the impact of the adjustments, sheds lights on participants' perceptive and experiences. Next slide. After we did this data analysis, the primary objective of this project was to enhance the efficiency of the VFC program through minor internal adjustments. To reach this goal, the strategy included establishment of a shared functional email box, the establishment of an FAQ repository, and a comprehensive assessment to identify specific areas requiring target outreach. Next slide. The establishment of the VFC shared functional email has shown favorable outcomes in effectively addressing concerns pertaining to communication speed and accessibility. This functional email box allowed VFC coordinators to promptly seek and obtain answers to the general inquiries regarding the program. During the data collection period, a total of 153 emails were received through the shared functional email box, and all to this date have been answered. Next slide. Um, as mentioned, a FAQ repository was created. The creation of the FAQ repository provided to be a valuable resource in improving information dissemination and addressing common inquiries. The FAQ repository served as a centralized and comprehensive source of information, leading to several positive outcomes. The VFC program staff used the FAQ repository to address questions from program participants. Next slide. Targeted outreach will be developed in the future through the examination of questions received by the VFC coordinators via the shared functional email box. Analysis uncovered three primary threes that included provider eligibility, vaccine storage and handling management, and vaccine reporting requirements. These themes highlighted the necessity for focused outreach in these specific areas. Providing outreach in alignment with these identified themes, prior research suggests that they can contribute to enhancing program outcomes. Next slide. With any project or research study, there comes limitations. It is imperative to recognize and emphasize that the purview of this undertaking is unintentionally delimited to the realm of affecting minor adjustments within the VFC program. It is pivotal to acknowledge that these adjustments can serve as strategic steps towards enhancing the program's efficiency and effectiveness. They may not comprehensively tackle all of the multifaceted challenges and concerns that the program might encounter. The dynamic nature of the VFC program's impact, both over time and across various contextual conditions, might only be partially included within this temporal window. Next slide. The project concentrates on minor adjustments that could enhance the perception and efficiency of the VFC program. The three key objectives were improving communication speed through a shared email box, establishing a comprehensive FAQ repository for standardized responses, and implementing best practice outreach for healthcare providers, ensuring adherence to program requirements. Next slide. In conclusion, consider these findings. It's become unmistakably evident that the orchestrated adaptations resonate with the very heart of the program's overarching objectives. The empirical evidence amassed in this project thus underscores not only the successful implementation of these internal adjustments, but also their profound impact on the program's functionality. These results provided a pivotal step towards refinement and optimization of the VFC program, standing as a testament to the power of insightful adaptations in shaping the trajectory of public health initiatives. So as I think back on my time over the summer, I realized that, for one, public health is more than just people who work in healthcare. I was on a team of data science people, program analysis, graphic designers who created dashboards and whatnot. So it really takes a team effort. And it starts at the top with leadership. I had excellent leadership through my preceptor and then through assigned managers. The other thing I would like to say that doesn't come out in projects or briefs that may come out to the public is federal operations is pretty governed by what happens in Congress. We can want the best as public health practitioners. We can want the best for the community or the population within this country, but if it's deemed unnecessary or out of the purview of the federal government, we can't take it on. And this is why the federal government, to a certain extent, leans on our state partners, our NGO partners, our nonprofit partners, even our for-profit partners. When you speak of immunizations, those big immunizations companies, to bring things like this to life. But overall, I would say it was a wonderful experience on the inside of what happens at the federal level of public health and I look forward to continue my career.